So let me say first, everyone, hello and welcome to this University of Maryland, Baltimore virtual town hall. Today, of course, we're discussing research with three right now, and I hope four of our top leaders. UMB Interim President, Dr. Bruce Jarrell, School of Pharmacy Dean, Dr. Natalie Eddington, School of Medicine Dean and Vice President for Medical Affairs, Dr. E. Albert Reece, and Vice President for Research, Dr. Laurie Locascio. Welcome to all of you, and thank you for joining us. I'm Alex Lukaszewski, Executive Director of Media Relations at UMB. My role is to help connect your questions to the panel. Before we start, I want to alert everyone that this program is being recorded and will be posted later on the UMB COVID-19 website, umaryland.edu/coronavirus. Also, if you have a question, please use the Q&A area of your screen, not the chat area, to write your question and send it. I may read your question for the panel, or I will unmute your microphone so that you can ask it yourself. And we'll start off from some questions we've already received from folks involved with the research. And I guess the number one thing people are asking, and Dr. Locascio, this came from you, people are talking to you, when will we be able to restart our research?
That is, that's the most important question I think everybody has been asking is when do we get back to work? And of course, as everyone knows, there's a lot up in the air right now, and we have to continually monitor the situation around us and watch what the governor is saying. And of course, pay attention to everything going on in terms of the increased numbers and the increased risk surrounding us in our state and really our country. But when are we going to get back to work? So one of the things that we had been discussing, I talked to President Jarrell earlier this morning, and we decided to put together a second task force. So as most of you know, last weekend we had a task force where we looked at what kind of restrictions we're going to impose on our research and when. What would be the trigger points from moving from our existing environment, which is normal operation, to a more restricted environment, moving to moderate research restrictions, and then finally to severe research restrictions. And of course, we put that in place, the move to severe restrictions earlier this week. Now, because the situation is constantly changing, we aren't sure where we're going to go next or where things are going to end up in the next couple of months. We'd like to put together another task force that can consider, when do we reopen? When do we start having people come back to work? When can the situation be under control, or when can we be in enough control of our own environment to allow people to come back into work? And so this new task force that we're going to put in place probably next week, we're still honestly quite in the middle of what I would say emergency operations, where we're trying to get all of these new restrictions in place and make sure that we can have everybody safe and secure for the time being. Next week, when we launch this new task force, we're going to be looking at different scenarios for the coming months, depending on how the pandemic progresses. And under these various scenarios of the pandemic progressing, we'd like to figure out ways, what would trigger us to be able to come back to work safely and securely on our campus. And so I would say that's where we are right now. Again, a lot up in the air, and I know everybody wants more definitive answers, but I think that's what I can speak to as far as that topic for right now. And I don't know, Dean Reece or Dean Eddington, if you have anything else you would like to contribute to the way that you're thinking about it as well.
Yeah, I think we're looking at the same kind of drivers to help us make those decisions. As you mentioned, it's not going to be easy, but we need to have the data drive the decisions that we're going to make.
And I would just add that the way I see it is that I'm treating not just research as a scientist myself, but seeing it in concert with other activities. For example, we have reduced non-emergent surgeries significantly. And so the question that we're asking him today is, when are we going to restore that? Well, we can't. And certainly it'll be a few weeks hence before we can even do that. So it seems to me as if, as Dr. Locascio said, we will have to look at a number of parameters before we can even begin to restore some portion or some aspects of our work, but it certainly is not now, and will have to be very much tempered by what happens with regard to the expansion or the transmission rate.
Dr. Reece, pardon me, could I ask you just to tilt your camera or your laptop, or just so we can see you a little more clearly there? Very good. Okay.
A bit better?
It's a little bit better. Yeah, thank you. Dean Eddington, anything to add to that? You have to unmute yourself.
Thank you.
Reece.
I agree. I think that we have to look at the data that's going to inform the decision. I know that this is always an active time for research across the School of Pharmacy, and I think it's challenging for those faculty members that are not in their labs on a daily basis. And I think we understand that. We understand the issues that we face. So I think it's important to, I think, make sure that our research community understands the decisions that we're making and how we're making those decisions, and be transparent about that.
If I could jump in and just make one other comment, and to say that the on a positive note, the NIH has actually extended the deadlines, and so in my own lab, for example, we're putting in a program project that was due March 13th, and they've extended it to April 15th, and they're willing to do another extension. So I think from the standpoint of just timetable, the NIH is willing to be very flexible. And if we have any questions, Larry Tabak, who is the number 2 at NIH, has actually said, call your program officer, and they will be very flexible, and they are going to make every effort to accept all grants. So I think that has been a very positive accommodation by the NIH that I think we should take full advantage of.
Great. I do have a question from the audience. Joe Greenspan has a question, and I will open your mic to ask that question if you'd like. You can go ahead and ask your question. Question about the animal use exception request. Well, the question is, what is the status of animal use exception requests which were submitted yesterday? Some projects are urgently time sensitive, he writes.
I'm sorry, I'd have to check on that and get back to you, but I'll try to do that through the course of the conversation.
Okay, we have another question. Let me see if I can get that questioner available. This is from Tamika Suber. Tamika, if you are ready to ask your question, it's about the IRB. Go ahead and ask it. I have you up. Go ahead. I'll ask. Yes, we can hear you. Go ahead and ask your question.
Thank you. Was wondering if for like the some of the clinical trials that can do that are not having intervention like medications or procedures, if there's a way that the IRB can approve e-consents in like a quicker manner, since I know that a lot of us are not doing e-consents yet. So for example, if we have a study where we go and we talk to a lot of patients about study X, and they're able to consent over maybe the telephone, or maybe we can do something through REDCap or something like that. Do you know if the IRB has discussed that?
If I could jump in and take that one. I think that, first of all, you've seen the research guidance relative to various types of research, whether it be clinical or basic research. With regard to clinical research, we have discouraged new research to be started. And so if this were an ongoing research, it would fall in different categories. Minimal risk, significant risk. From what I'm gathering from your conversation, it would be a new research of minimal risk. And we would very much not want to advise that at this time.
Okay, we have another question from Casey Jackson. I was asking, is similar, along the same lines as our first question. Casey, are you there?
I am. Can anyone hear me?
Everybody
Yes.
can.
Oh, thank you. Thank you all for being here. So as the research quality manager for the School of Nursing, I've been getting a lot of questions about non-clinical research and also non-human subjects research projects. The guidance that has come out kind of points to clinical research, and so there's been a bit of confusion as to what people should follow when they don't have clinical research or NHSR projects. And I've just kind of been guiding them to the clinical research guidelines from like a common sense standpoint. But do you plan on updating or releasing guidance from an institutional standpoint that addresses those types of research or NHSR projects on campus?
So in last week's email from President Jarrell, there was quite a bit of discussion in one of the attachments on non-clinical research, moving from moderate to severe restrictions. I'd be happy to share that with you again, or share that more broadly, or ask President Jarrell to do that. But
Sure. I think that most of that, though, that guidance pertained to animal and bench science and not really like survey-based research and things like that. Sorry to cut you off.
No problem at all. So you're looking for more guidance in sort of a survey-based research where you're interviewing subjects or you're conducting surveys off campus.
Yeah, things that don't have a clinical purpose, but they're still research and they're not bench science. They're not working with cell lines or labs, lab animals, but could be, the NHSR projects that a lot of students have, or, certain faculty on campus, more kind of along those lines.
Sure. So I'm happy to put out some guidance on that specifically, but if you have a very specific question, please reach out to me. I'm happy to answer that as well offline. Actually, I should give my email. It's lel@umd.edu. And I'm more than happy to answer any questions directly, but I can also put out some guidance on that. But in general, I'm going to say that if the work does not require face-to-face interactions and can be performed remotely, and it has been approved by the IRB, then yes, everything can continue as normal. I would say that the issue is really with on-campus research activity in a laboratory where people are going to be needing access to space and they're going to be in close contact with others on campus, obviously. And then the other guidance that we did put out was to do with clinical research, again, because a lot of that involves, of course, face-to-face interactions, and it also requires on-campus access to facilities. And so generally what I would say is if it can be done remotely, it's been approved by the IRB, and it can be performed in a way that it doesn't require access to facilities, you should still be able to continue in that research. Did I answer your question?
Yeah, thank you. Yeah, we have hundreds of studies that are kind of that nature. So yeah, we would greatly appreciate some guidance that could be distributed. Thank you.
Sure, of course.
All right, I'd like to turn now to Scott Bittner, who I know is in the audience. He's our Deputy CFO and Senior Associate Vice President, who I think has some questions and answers that we wanted to make sure the folks from A&F had a chance to put out there. Scott, are you with us?
I am. Can you hear me?
Yes.
Okay. So we had a meeting with the Associate Deans for Finance this morning, and some questions were asked that we pulled some minds together to come up with some answers. So I'll just run through those if you want. So the first question was, how should time work be recorded for contracts and grants? So all work that is being performed on the contract and grant, whether on site or off site, should be charged to the contract and grant. If the faculty or staff are not able to perform any work, they should charge administrative leave unless they are using another type of leave due to their personal circumstances. And does it matter whether the sponsor is federal, state, or private? The answer is no. We should follow that same guidance for working on contracts and grants across the board. Should the employee funding profiles be changed as a result of using administrative leave? For the most part, no. At this time, the employee funding profile should not be changed as a result of using administrative leave. Will the administrative leave be charged to contracts and grants? Yes, the administrative leave will be distributed, prorated across the employee funding profiles accordingly. Another question was, will the sponsors pay for the administrative leave? So currently, we only have approval from the federal government that the administrative leave for COVID-19 pandemic will be an allowable charge. This should also apply to all pass-through awards through non-federal sponsors that originate with federal funds. We have had some pushback from the Maryland Higher Education Committee that they will not accept these charges, even though they have been allowed by the federal government. We have not received any guidance from any state or private sponsors on whether they will allow administrative leave at this time. So we'll continue to treat these awards like federal awards until further notice. And if the administrative leave will not be covered through the contract, how will it be covered? And so for those contracts and grants where it will not be covered, the administrative leave will be transferred off the grant to a revolving account. That's all I had.
Okay.
So a few clarifications on that, and thank you so much, Scott. I wanted to just add that, yeah, the federal government is being extraordinarily generous, as Dean Reece mentioned, and also Scott, that there has been an issue with a few contracts. So we've heard from some agencies that contracts or specific program managers, that contracts are being, that people are asked to stop work on specific contracts. If that happens to you, I've been finding that they have been very open to appeal and sort of quick contract modifications so that you can so that they can accept or allow this to happen under this condition. So if you have questions about any specific contract or grant, a lot of this is general guidance that we're giving you, but there are some very much specifics that you're dealing with that we can help with. So please send in any questions to the Sponsors Program Office. So Dennis Pathrath, who will be able to field those questions, send them to the right people, and get back specifically to you about issues with your specific contract or grant if you have questions. I'd also encourage you to as Dean Reece mentioned, reach out to your program officer, reach out to the person who's the program director, because right now we are not, as a university, sending out specific or we aren't going back more broadly to the agencies at the university level. But we do encourage you to go back to your specific program officer or program director and tell them, hey, this is what's going on at my university. Is there going to be any issue with that? So I encourage you to reach out and be in contact.
One question we've heard a lot of, and this is sort of a basic question. Let me take a step back from the nitty-gritty to the basic, which is, if we're using social distancing, what's the harm in doing our research? Why can't we do it as long as we, much of our research people do alone or they're with partners, but they're at the other side of the lab. What's the harm in that? Anyone want to take that?
Yeah, let me try. We have followed the governor's lead, and it's just that the governor has made a directive that we have to reduce or the volume of contacts that we have. So within the workplaces that where there is not essential work, high priority work to do, we have been admonished that people should try to work at home, stay at home as much as possible. So I certainly understand very much that in fact under the moderate restriction we did that. We basically allowed research to continue unimpeded under that rubric because we thought as long as people are taking the social distancing principle, then working would not be a problem. Under the severe restricted research is really when the governor increased his directive that we really want to have people staying at home and basically out of contact with, not have a lot of interactions. So it's really is an attempt to really flatten that transmission curve that we're trying to do in accordance with the public health recommendations and the governor's mandate.
Anyone else want to give a sense for that? That's pretty complete answer. Another question that we have, this is a person sort of remaining anonymous, so I'll just ask the question. If you are employed by UMB Research, can your PI require you to come back to the job and move your work for UMMC, FPI, or the VA for COVID-19 testing? I'm sorry, and move you to work for, I'm sorry, the COVID-19 testing at any of those institutions. Can your PI ask you to come back and redeploy you?
So you're saying if the person is feeling compelled to come back to the university to shift projects and work on a COVID-19 project, what happens in that circumstance?
Right.
So maybe I'll let the deans answer that specifically.
Dr. Eddington, you want to take a first crack? I think she's on mute.
Yeah, this is a difficult one. I think my perspective, this might be something that a staff member is wanting to know now about research that might be going on. So all I can say for this is that I think that research, we don't have research in the School of Pharmacy that is so essential that and is also looking at supporting research around the virus. So we don't have any examples of that. I do think that I can respond from my perspective. If the research that's ongoing in a lab in my school that could be helpful and is high level, I would want to continue that.
And if I think I understand the question well, and I apologize if I didn't quite understand it, and that is, I'm assuming this, we all live in a free country. So if someone is not being compelled to come back and do research or something vital research, then I think that is all in support of trying to get to the right answer. I would be very much opposed to compelling someone or trying to insist that somebody must come back. That would be out of line. But I think that we have a number of research programs ongoing in the School of Medicine in particular that has to do with either vaccines or therapeutics or clinical trials related to COVID virus. And if an individual gladly wants to be a part of that team, by all means. And if the team could use that person's effort, I'd be fully endorsing that. Maybe we could make a breakthrough and we would all be happy and all be cheering. But it must be with some level of someone's willingness to do and not by compulsion.
And so I'll just back that up and say that everyone knows that we are allowing COVID-19 research to continue. And this is true, I think, across the United States. While there's severe research restrictions across the US and all the universities, um, almost across the board, people are still allowing COVID-19 research. But for a lot of reasons, people may just not be comfortable coming back to work for many reasons. And we all know we're in the middle of a public health crisis. People have various degrees of pressures externally, various degrees of comfort in being outside, various people that they could expose to COVID-19 if they brought it home. That would really be worrisome. And so I think I really would strongly back Dean Reece by saying, please don't feel compelled to be here if that is just not something you can do because of your level of comfort or because of extenuating circumstances outside of your control. But I would say that we will allow COVID-19 research to continue. It's in the middle of the public health crisis, and whatever we can do as a university to help would be wonderful.
Taking off what you just said, we do have some people who would like to find out how they can play a role in that research. I'm going to open up Christopher Morgan's mic, who has a question along those lines. Christopher, if you're with us, and you can ask your question.
Sure. I guess I was just wondering if there were any opportunities for researchers or bench scientists who, whose projects are not related to COVID-19 to assist in any other research efforts, whether that be extra hands in a lab or helping with some tasks in the hospital or in the city. If there are any opportunities or thoughts of taking advantage of those of us who are not doing our research now to kind of help more broadly.
That's a very good question and a very magnanimous offer. And I would say that I obviously couldn't answer it by saying, yes, there is a particular need here or there, but my suggestion would be for you to contact a few people. I'd suggest you send an email to Dr. Kathy Newsel. She's the Levine Professor and Director of the Center for Vaccine Development. And she has a bandwidth that would be able to give you some sense as to need or possible opportunities. The other person I'd suggest that you contact, but I think Kathy might be able to cover the waterfront. If she's not able, I would say you can contact, I'm sure you know Dr. Matt Freeman, sorry. And he would be another basic scientist who I know is in the middle of major research. So I think Kathy Newsel in Center for Vaccine Development would be able to give you contacts either in the Institute of Human Virology or in the Department of Microbiology and Immunology or the Center for Vaccine Development. Those are the three areas that I know are pursuing research relative to COVID virus, either therapeutics or vaccines or both.
I'd like to take this moment to bring in Dr. Jarrell by phone. I'm going to unmute his mic. Dr. Jarrell, are you with us? Dr. Jarrell. All right. We'll try again. Right now his mic is unmuted, but he may not have the mic turned on. We'll continue to work on that. I have another question from Priya Dasarma. I will let me scroll down to where she is on my list here so that I can bring your mic up. And go ahead and ask your question. Dr. Dasarma, are you with us? I'm not having a good run of luck. I guess her question was, she said the other matter about coming to labs is surfaces you can transmit without seeing the carrier. She's saying, is that right? So that may be another reason why we can't use labs. Is that true? Does anyone want to amplify that or explain?
So yes, I mean, all the data shows that this virus can live on be on surfaces for a long time and and carry the disease from one person to another very easily. So yes, that is one reason. Now we have in place uh, a lot of suggestions, or CDC provided guidance for how to prevent um, or you know. How to take proper precautions to try to prevent transmitting the disease from one person to another, cleaning surfaces, wash hands, staying 6 feet apart. We all know these things, but still, as Dean Reece, I think, said so eloquently earlier, we really do need to take the utmost precautions at this time when the pandemic is uh, becoming such a critical problem across the United States and in our region.
Okay, I have Fadia Shaya is trying to ask a question, and I'm going to unmute her microphone. Are you there with your question? Asked me to unmute her. Well, I guess our technology is not 100% of the time. Will the questions do we have here? How will time be recorded for contracts and grants? Is another question. And I know Scott touched on that, but I guess the answer wasn't as clear. Can anyone describe how do you record your time for contracts and grants during this time?
I think just generally, if you are still working and you're working remotely, you report your time as you normally would, because you still get credit for working remotely on those projects. The time that you aren't working remotely, you log that as administrative leave. And on the grants, we'll be keeping track of time spent on administrative leave. On federal grants, that time is allowed. You can charge that time. On specific contracts, it's unclear, which is why I said it's important to reach out if you have a question about your contract. But I would say continue to charge on your grant, either as real time spent remotely or as administrative leave if you can't access your laboratory, unless you receive specific guidance not to.
And I'd like
Okay,
to
I'm
add
gonna
to,
try.
I'd like
Oh,
to
I'm
add to
sorry.
that. I'd just like to add to what Dr. Lukaszewski said, and that is just to kind of remind everyone that most of us are continuing to work. And even though you may not be physically in the lab, you're continuing to work. Again, most of us are lab scientists, and we're using this time to write lots of papers that we didn't have time to write during the time. So we have an opportunity, we have an inbuilt opportunity to either write or rewrite our grants or write publications, manuscripts, and that becomes a real time effort that you can record, as Dr. Lukaszewski just said. So don't undermine all the wonderful work that you're doing, not necessarily in the lab, but outside the lab.
All right, I'm going to try with our technology one more time with Amy Nelson, who is a PhD student. Amy, if you're out there, unmute your mic and ask your question. You know, it's not our day with the technology, but I'll ask it for her. She says, as a PhD student with a small study requiring some face-to-face time with subjects and bench time, which is awaiting IRB approval, at what point should you suggest changing the entire proposal in light of the upcoming planned completion dates?
It's a tough one.
That is a hard one. That's a really hard one. I don't know if Dean Eddington or Dean Reece want to say anything to that.
I can only agree with you and say that's a difficult problem for us to try to answer at this point in time, because we really don't know.
And I would agree very much as well. But what I'd put a little an added recommendation, and that is to give yourself a reasonable time frame. If by the summer we're not able to, then I would suggest you change. But I would give myself a reasonable run, and the reasonable run could be 3 to 4 to 5 months. And if we're still locked out, then I think it's with time to change. There, Dr. Jarrell, look at him. He's right there.
I don't know, can you hear me at all?
Yes, yes.
It's the miracles of technology. We've been working on this for an hour now to get it to work, and it was rejecting me. I take it personally. So I've been able to listen to some of it, but please accept my apologies here. I did hear the one question about the IRB, and I think Dr. Locascio said it. If it doesn't involve direct contact with human subjects, you should talk to the IRB staff and find out whether it fits in or not. The idea isn't to restrict clinical research. The idea is to protect all of the participants and our staff. So I think she gave a good answer on that. I have no idea what other questions I missed, so I'm sorry.
Maybe you could give your spin on when all this is going to be over.
I don't know any better than any of you. I think, though, that again, Dr. Locascio gave a good answer, and that is we need to be prepared to iteratively increase research as the local environment allows us to do so, and that's going to be a judgment. There's not going to be some magical moment, and it'll be based also on the number of safety things put into place to make sure that it's safe for people to come back in the labs. So I think we don't want the labs to not be operating in person, but only remotely. So obviously we're in a planning process already on what would be the steps and what would we need to put into place to make that happen.
Okay, we have one more question here that I'm going to try to unmute. John Olsen, who is a clinical faculty member, has a question about NIH-funded research. Mr. Olsen.
Hello, can you hear me?
Yes, go ahead.
For those of us that are clinically active and will respond to the clinical demands of the pandemic, yet have budgeted effort and time that we would necessarily reduce to meet our clinical duties, do we have to do anything regarding notifying for changes in our percent effort as may come about because of this? You know, if we're funded by the NIH, for example.
I wouldn't think so, John. I wouldn't think you need to do that just now. I think, as Dr. Jarrell said, if this thing goes on for a very long time, then that may be a possibility. But given the fact that it's unknown, exactly. I would advise not to do anything just now. I think you're fine.
Right. If you want to defend yourself, keep records to show the amount of time you're working in the lab, because that would be one other piece of evidence to say, yes, I'm taking my research seriously.
And John, I know you're probably writing your next R01 now, so that's effort.
Yes.
And depending on the timeline of work and deliverables promised, you know, as it progresses, you should probably talk to your program officer if it goes on for an extended period of time. And as long as it doesn't go below 25%, I don't think you need to talk to your program officer.
Okay, I have a question from Deandra Brown. It's a topic we've touched already, but I don't think the answer quite came through. Deandra, are you there?
Hi, can you hear me?
Yes, go ahead with your question.
So my question pertains specifically to patients who have already been enrolled into a clinical trial and are receiving investigational drug. And, you know, we're discouraged to have face-to-face interaction with our patients. We're really being discouraged to, you know, continue if it's not necessary. But if this is the only treatment that the patient has for their disease, do we need to seek advance permission from you all to have these clinic visits maintained? Because I know you guys were giving examples of like chemotherapy as a critical type of research. But, you know, I am in IBD, and We know that the GI tract is a pathway for disease contraction. So we want to make sure that our patients aren't in a flare that could then put them at risk for, contracting COVID-19 because they're already immunocompromised as well. So I want to make sure that, we're doing the right thing, that I'm giving my providers the right information about how we are to continue our practice for the few patients that we have currently scheduled to receive medication.
So maybe I could start with that one. So the general response is you have to balance a number of things, and you always have to do this in clinical research. So our first priority is to maintain patient safety and welfare as the driving goal here. If a subject is already enrolled in a clinical research trial receiving a medication or an intervention, and withdrawing that medication or intervention would be harmful to them, then obviously you should not be stopping that medication, and you should be continuing the care. Now, you might want to ask yourself a question about how frequently do I need to see this subject in follow-up, et cetera, because the other thing you're balancing here is that you just finished commenting that your patient's immunosuppressed, and so you certainly want to limit their exposure to COVID the same as you want to limit it to yourself, and they're perhaps even more vulnerable than you are. So you need to balance those various things to try to optimize the care. My advice to you would be, where there's a question, you ought to talk to the IRB chair and get his advice as to how he would balance these things. And if you're concerned about that, the institutional official, Susan Buskirk, has the authority to make the decision about something makes sense or doesn't make sense. What we didn't want to have happen was business as usual. We're doing clinical research. There's no harm in pausing this. If there's no harm in pausing this, you should pause it. If there's harm in pausing it, or if it's a serious disease and you need to continue the treatment with the hope that it's therapeutic, then that's the position you want to be in. But the bottom line first is subject safety and welfare. And withdrawing a medication might not support a subject's health or welfare. Does that get to your answer, or do you have a further question?
I'm sure I moved along the list, so I won't know the answer to that. But I do have a follow-up from Joel Greenspan, who had a question about animal use exception requests that maybe you can answer. Let me find him on the list, and I've unmuted you, Dr. Greenspan.
Hello, can you hear me?
Yes.
Having this. PIs with ongoing animal studies were given an opportunity to submit a basically animal exception to the hold on animal research if in fact their projects are time sensitive or have a very in process. And two of my faculty did such a submission that were sent through our dean to your office yesterday. And of course, part of the urgency is that these are ongoing projects where if assessments or interventions aren't done at the right time, it'll kind of collected. So I wanted an idea on the evaluation and approval of those exception requests.
Well, Dean Reece should comment too, because he's the institutional official on animal research for UMB. But he has put into place a process where those requests get evaluated by a group of scientists, referred to him, and then he and I'll discuss what should proceed or what needs to be held on. And we're just starting up that process. Dean Reece, any comments on that?
Yes, hi, Joel. So essentially, we have asked for all department chairs, directors, deans, senior leaders to really query their faculty and to determine whether or not there are any exemption requests based on certain key criteria. We are just about getting responses, and so the responses are reviewed by a small committee, and then they in turn will send them to me for Dr. Jarrell and I to decide. I haven't yet gotten them, but I'm told that they expect to get them done this week. So that's where things are. We're using a process, and you've been early in the response, which is great. But we want to make sure that we get all the responses. There's a specific date that we gave. We gave a deadline to respond to, and as soon as the submissions are complete, we'll get on it immediately. So I can only assure you that I hope by the end of the week we should have the deadline will be passed, and we'll work on it. So I would think no later than early next week you'll hear from us.
Okay, yeah, I understand there's a process. I just,
We'll get if you have an issue, you give me a call. But we're gonna move on it quickly. But if you have a specific issue of certain unique urgency, send me an email, and I will deal with you right away.
thank you very much.
Okay, I have I think we just have time for a couple more questions. We have a question from Laura Stepan. I'm going to unmute your mic now. Do you want to go ahead and ask your question? Well, the question is, one of my PIs had their IRB modified to send surveys via email and postal mail, no physical contact. Upon completion of the surveys, the respondent usually receives a gift card. How will those gift cards be purchased, given that we are working remotely?
Scott, is Scott Bittner still on the phone?
I am Dr. Jarrell. Susan McKechnie is currently looking into that. So we hope to have some options identified soon.
Okay. An anonymous question. Are we looking to research labs that have capabilities to fast track testing, et cetera, to fill in gaps that the hospital has?
Dean Reece, you've been spending some time on that one.
Well, first of all, let me. I'm always very excited when I hear or research faculty want to help out in something that's practical, needy, important, and imminent. And I would say, why don't you email me? Let me tell you why. There's a research group working with a clinical group and trying to fast track testing as we speak. I never want to turn down volunteer work. I mean, the fact that you're eager and willing to either volunteer or give ideas, or I don't want to turn that down. So send me an email, because at this moment, we think we are on something positive. But I always want to have an alternative. You may have a brilliant idea, and I want to hear it. So send me an email, and I will make sure that we incorporate your ideas into our group as well.
Right, and one constraint that we have, of course, is if we're actually testing for the virus or things such as that, there are a lot of state Department of Health rules which we have to work with in order to stick with the law. So right now, we do have to be careful about testing that's not in a certain approved kind of situation. So just be aware that there are constraints that the Department of Health puts on us.
Absolutely.
All right, I have just two quick questions left. One is the IRB continuing to consider requests at this time? And the other is will there be an extension on the tenure clock for junior faculty?
So the IRB is actually was the first group completely 100% teleworking. They've been teleworking for a long time in terms of phasing that in. So they are fully engaged, and they are considering new protocols, et cetera, with the proviso that once something's approved, it doesn't necessarily qualify under the current restrictions. But as soon as those would change, then you'd be able to go ahead with the research. The second question, Alex, was what related to what?
Was whether the tenure clock for junior faculty was being extended.
And I think Dr. Ward answered that yesterday. The regents have been very generous to the chancellor to allow a liberal interpretation of our policy. Our policy we just recently changed to allow I'm going to put quotes around the word automatic, So if you have family obligations, like a new child in your family, you're allowed up to 2 years. We have the liberty to allow a 3rd year. And I think the answer that I would give at the campus level is we would want a very liberal interpretation of extending the tenure clock. I have 2 deans on the screen here. They could give their own take on this as well.
Eddington.
Yeah, I would be in agreement on that as well.
And I'm in total agreement as well. I think we ought to be very flexible in these times.
And I guess the last question that I would put out there, that it's something that was talked about early on, but Dr. Jarrell, now that you're here, is the question of the criteria that will be used to bring things back to normal order. What are your thoughts on that?
I think it's going to be a combination of things. I think you already heard that we're following the lead of the governor. You should be all very proud of the position that the governor has taken in terms of being in front of this whole process. I've been very pleased with what he's done. And so we've tried very hard to stay in line with his thinking on this. So one measure would be that the state is taking a more permissive view on this. A second determinant would be, again, the availability of safety equipment. So you all know that there was a huge rush on N95 masks and other protective equipment. Were that to become a lot more available, that would be a second variable. A third variable would be to look out into the community. So you may have heard Dr. Fauci speaking this morning of how some communities are very hard hit and other communities have not been hard hit. And if Maryland happens to be one of those where we have done a good job in containing this and we can liberalize, that would be another way to make that judgment. I don't think there's a magic equation. I'm an engineer. I always look for an equation. I don't think there's any equation here. I think this is a judgment. And it'll be based upon the advice of well-informed people around the group of the people you see on the screen and others, listening to the best advice. Having said all that, you know, research is like the economy. Although I've heard it said you flip a switch and it suddenly starts, it doesn't work that way for research, I am sure. And so the longer we're out of commission, the more difficult it's going to be to get things back up and running and labs working and people efficient and generating the ideas that we need to have, and et cetera, et cetera. So to me, there is a compelling reason to get it sooner rather than later, but it's got to be safe. I mean, we're not in the business of hurting people. We're in the business of helping people. So whatever we do, we've got to make it safe. So that'll be a major part of the judgment. And the 3 people on the screen there, do you have anything to add to that?
We concur.
Absolutely.
Well, that's easy.
Well, we're out of questions. So unless you have more issues you'd like to address, if anyone has any final thoughts, this is a good time to get those out.
I have IT issues, obviously.
Well,
I
yeah.
can't bring them out today.
If there's nothing else, thank you for your time. I know everyone is extremely busy, and I know that our audience appreciates getting some answers to those questions. And of course, we'll continue to try to answer questions that we get and post them on the coronavirus website under the frequently asked questions. So good luck to everyone, and thank you again for your time. Take care.
Thank you.
Thank you.